Hi everyone, this is Aurelie Najm from Glasgow, live from day 3 of ACR in San Diego. I'm just out of the plenary session, and I've seen this, this abstract, and I wanted to share it with you because there's been so much discussion over the past few years, especially with the Gloria trial, saying, glucocorticoids are harmless. Just like give them to people, and they'll be fine. And I think we need to remember that actually glucocorticoids increase cardiovascular events, and so this abstract, which was number 2430, was looking at the veterans database in RA, and there had been studies already showing that yes, taking glucocorticoids increase cardiovascular events, the duration, the dose, but there had never been a study where the analysis was adjusted on time of exposure to glucocorticoids. And so this is exactly what this study was doing. And so they were looking at the time to major cardiovascular event. It was a very conventional definition of MACE. And it was adjusted for many variables with the caveat that it was not adjusted on disease activity. And this is something to keep in mind. But so they used these methods where they looked at weighted cumulative dose estimate. And they looked into 19,000 patients roughly. So first of all, the 2/3 of them were currently treated with glucocorticoids and had exposure, which is quite a lot. And 1/6 of the population, which was roughly 15%, had a period of 90 days or over of glucocorticoids exposure. So they stratified the population in 3 different groups: no steroids, those inferior to 1.2 milligram per day, and those over 1.2 milligram per day. And so what they found is that the risk of MACE was 6%, so twice the risk for those who were exposed to over 1.2 milligram a day, as opposed to those patients who were treated with less than 1.2 or no glucocorticoids. And so there was no difference between less than 1.2 and no exposure at all. And then they looked into 2 different groups: those who were currently taking the glucocorticoids at the times of the MACE. And so what they found is that for those patients that were exposed to 5 milligrams for only 30 days, which is not much if you think of it, there was an increase of 5% of MACE, and those who were treated for 90 days with the same dose, which is 5 milligrams, there was an increase of 10%. And I think it's important to keep that in mind, because technically 5 milligrams is a dose where you can easily think, that's not much, we should carry on with that. But actually, there's a risk there. And also, those who stopped using glucocorticoids at least 1 year before the MACE, they also had an increased risk that was persistent after a year. And this was the case for only 30 days of exposure, again, with an increase of 3%. So I think these results are telling us that the glucocorticoids do carry risk. And so they're not this, super easy treatment to give to everybody, and under 5 milligram, everybody's fine. We need to keep in mind that obviously this study did not adjust on disease activity, and we know that disease activity is a strong driver of cardiovascular risk anyways, but I think this is just telling us this, and we need to keep that in mind. And I think that's it. That's what I wanted to share with you today. Follow me on Twitter for more content at Aurelie Najm, and tune to runnow.com.